and welcome to our second in a series of seminars for the social care sector in regarding international recruitment. And we've kindly been supporting three ICSs: Pan London, North Central London, South West London, and South East London. And today's topic is unlocking sponsorship licenses, as I said, cost, complexities, and compliance. It's such an important area because getting your records in order is important. And if you bring someone into the country, one of the first things they're going to check upon and ask upon is your compliances as well. But also as well, in doing all of this, nothing's ever for free. There are costs to it and the complexities in regards to getting your license, working with different groups, especially things like the Home Office is really important as well. So do bear that in mind when we're going forward. So those who may have missed the last session, just to let you know who LCAS are, just ensure you're not sure. LCAS is part of the London Care Association Alliance, national group of care associations. We work with commissioners, we work with providers, stakeholders, we work with Skills for Care. We have an array of things that we're doing as well to provide information and exchange of creating a better understanding of user requirements and a constantly changing marketplace, and to encourage higher quality standards through workforce development, enhanced management, and good leadership. I guess if we were to really say that, we're probably the middle people between yourselves and people such as commissioners, also Department of Health and Social Care. We play a big role in trying to be a voice for yourself, but also giving back information and also funding projects where we're able to support you as well. So that's really important for us as well.
Yeah, I think it's probably worth saying at this point that we do have a lot of contacts and we do get asked a lot of questions, but there are some things that we can't resolve or sort out. And that frequently, one of the most frequent questions we get asked is around fees and getting paid. Now, we may be able to help you with getting paid, the process, but fees, that's really down between you and the local authority, or you and the NHS, or you and your private client. We have run a couple of events around that outside of international recruitment. But if you do have queries, then do contact Dudley or myself. It's all confidential, and we will see what we can do to help you out.
And we will be sharing the presentation, everyone, so don't worry. It's also been recorded as well, so we'll give you a link as well for that as well. So that should be fine. If you weren't here for the last session, it was around the ABCs of overseas recruitment in social care and laying the foundation for overseas recruitment and why it's vital. We will share the link in the chat as well, so you actually can go on YouTube and actually can watch it from now on in. We had an array of questions that we are getting feedback for as well, so you're able to access that. And on the website, you'll be able to access as well the slides, as well as some of the questions from the actual session as well. So we're trying to have you covered in many ways possible, and really trying to help you with all the things that we're trying to produce to support you. But it wouldn't be anything without your questions, and we're trying to do our best to answer it. And one thing I do say, which is really good at the moment in time, we're using, and we had our lawyer in called Toby Way. He'll be coming again today, and he will be obviously be able to answer some of your points and share some of the things that he's been doing and what he's heard in regards to reaction to what's taken place this week. But we will get before the end of the session about maybe 40 minutes or so for Q&A. So please do have some of your questions if you want. You can put them in the chat box. You can put them in the chat box along the way, but we will try and get to them when we can as well. So bear that in mind rather than worrying about it. And as Peter said, you can ask us questions directly in the chat box, or you can send us a note privately. And as we said, Peter's put our information in the chat box as well. So go ahead, Peter.
Sorry, Dudley. What I'd also quickly say is that some of the changes to international recruitment are not yet definite. We don't have some of the dates, and we've already seen some clarifications around particular areas. Now, as you might expect, there are people already out to sell you a service, telling you that they can give you all the advice. So my advice would be to be very cautious about signing up for anything that costs you money until the rules and regulations are cast in stone. And legal opinion is actually legal opinion, not a legal standard. So, as I say, do be very careful, because we've seen people sign up for all sorts of things in social care, which frankly are costing them a lot of money and not giving them the right advice or pointing them in even the right direction. Dudley.
That, Peter. And as you can see here, I think there's lots of people unsure, unclear, perplexed, disorientated, bewildered. Some of the things you can see here, and it was always like that beforehand, but now with what the government has sort of recently sort of spoken about, I think there's been more questions and answers. And as things are very fresh, we're going to try and see if we can dissect and just give you a bit of guidance and clarity so that you're a lot better from when you're leaving this today. So first and foremost, I'm sure most of you haven't been aware. On Monday, last Monday just gone, the UK government introduced a comprehensive new immigration policy. The policy is part of a 5-point plan aimed at reducing net migration, which is, according to the Home Secretary, James Cleverly, has reached concerning levels, and thus the need for the policy change. I think it's also touched upon a series of immigration reforms to reduce the level of legal migration, and which has reached record-breaking figures in accordance with sort of like the latest report. So I think some of it has been around that as well. So you can understand the importance of it here. Peter, did you want to add anything in before I go to the next slide?
I don't think so. I think it's worth taking a bit of an overview about the benefits of migration and looking at the actual situation of work placements in social care. The last survey was something like 150,000 vacancies in social care, and this is rising and will rise as we have an aging and more vulnerable population. And the only way that that is ever going to be fulfilled is either through automation of social care, which I think is unlikely to happen, or having more people to actually do the work. So it seems to most people that immigration is the only way to be able to move forward. Okay.
So let's touch upon the headlines that people may have sort of heard of, as we said there. So you've got two sort of columns there, and for those who are aware, headline was that the minimum salary requirements for skilled worker visa is to increase from 38,000 to 38,700 from 26,200. And as you can see, which you will probably very happy about at the moment, is that health and social care visas are exempted from this new policy. So I think that's the first part of relief for us in regards to that. So everyone who's here is probably thinking, you know, what's going on here and how they're going to fit in there. Also as well, I think the thing to worry about, or to be concerned about, care workers will not be permitted to bring their dependents on the UK. That's reversing the current rules. So given that most workers bring in their dependents and children, and ban on doing this is likely to make working in the UK less attractive than those working in other countries. So I think this is the biggest change and rule that people are probably worried about. So I think the fees are still, you know, we're still happily be able to sort of like work with that, but it's a dependence, which is the biggest change and the one that most people should be concerned about. The surcharge is obviously for those outside, and so we're still lucky enough to work with that. The points-based system, once again, we're on the shortest suppliers list. That means that we're able to sort of navigate that as those working in health and social care, should we say. It has also will affect those as well with students and dependents on students will not be permitted to join from early next year, except for migrants using higher education courses. However, all of these are due to be under review, and I think it's important that we make a note of that. I think it's also as well has done, obviously, it's done to reduce the amount of social mobility of those coming into this country. So the other thing that I think people are probably panicked about is the above changes are expected to come into place only from spring 2024. So presently, everything as is. So nothing has changed presently. It's not going to change to 2024. So I have been told that lots of people are going to try and get lots of visas in and lots of care workers coming in now. So I expect a raft of it to be coming in before this time spring. So do bear that in mind. I think as well, we have to understand there are about 152,000 vacancies in social care, and there's been an influx of about 70,000 plus staff alone this year alone. So it's surprising that the government has gone down this route. But as we said, we're still on the shortage occupation list, and that helps us. But we also understand that because of the lower salary threshold for those working in health and social care, there's been a huge reliance of those from overseas. And I think it has made it easier for us, obviously, to gain and get people in to support those in a already sort of struggling industry when it comes to recruitment. So I think it's hugely important that this still is a subject matter that's sort of been reached and spoken about. Peter, would you want to add anything to that?
I think the only thing, and we're not exactly clear of these yet, but there are differences between people being employed in social care and people being employed in the NHS. And this also includes nurses. So if somebody comes into the UK and they have a PIN or they gain a PIN, there will be different rights, whether they work in the NHS or they work in social care. And one effect of this may be that those nurses then look to migrate from working in social care to working in the NHS, which is obviously not going to be good news. We've got colleagues who are meeting or have met earlier this week. We've yet to see the report with UKVI, and one of our colleagues has just got co-opted onto a committee working with the Home Office, etc., to try and sort some of this out. So as we get information, we'll feed it to you through the LCAS website.
You will do indeed. And it's been a really important time. I've been at the House of Parliament this week. Peter's spoken. We've spoken with Skills for Care, who are directly linked with the Department of Health and Social Care. We are constantly in touch and trying to update you as much as possible. But just going back to Peter's point just then, nurses are the grey area, because potentially you can be a nurse but still also work in health and social care. That means you may be eligible to bring your dependents with you as well. And so I think it's most important that we do this. So we will bear that in mind. So thanks for that. And I think going beyond that and moving onto it, this is a slide that I've sort of shown, and there's been a study by the Migration Advisory Committee, MAC review, that was done basically in 2021, 2022. And what it's suggested is, as you can see here, and seeing how everything is going on, they expect that the amount of care workers that are needed to fulfill the roles is going up. And as you can see here, care workers alone for this year, we're looking in a range of 644,000. And as you can see here, in the up to 2028, what the amounts are. So it's that's ongoing. So actually, in taking this, what the government is doing is actually limiting the amount of staff, potential staff, to fill a massive hole that we've got already. But it's also contrast as well, because if you think about it, the highest proportion of visas have been issued has been for those with health and social care visas, and they account for up to 63% of actually those receiving visas coming into the country in regards to overseas workforce. So social care as well also provides a significant contribution to the UK economy of over 51 billion And today's measures will ensure we continue to protect, obviously, those from NHS and health and social care systems, but whilst addressing sort of significant sort of concerns that have emerged, which the government has looked at since obviously the introduction of the visa. There's been about high levels of things such as non-compliance and the work exploitation and abuse within the sort of adult social care sector, and it's particularly for overseas workers employed within care occupations. So it's really led to a real range of why so backlash has come onto health and social care. So it's also being responsible for what we're trying to do as employers and managing the staff as well, which is a huge gap, as we can see. Which goes back to say that we spoke with CQC, or CQC came when we were in a meeting with CQC, and what they've issued out, as you can see, was issued and updated on the 8th of November 2023, and it's the regulatory sort of policy position on modern day slavery and unethical intentional recruitment. And you can see here what they've stated here. We recognise that workers recruited from overseas are a hugely valuable and important part of the UK's health and social care workforce. International recruitment itself is not a risk that leads to modern day slavery. However, if we bear this in mind, a nationwide shortage of staff across health and social care, along with recent changes to immigration visas, has introduced concerns and increased the risk of mistreatment of both and the existing workforce and internationally recruited staff. This includes our increased the risk of modern slavery and unethical international recruitment practices. So it's really also an area now CQC probably weren't looking at before, but now they are. And I think it's important to know that they will be looking into things such as if they receive or discover information that may indicate modern day slavery, they will identify and log the risk. And they will do this even if the person contacting them does not refer to it as modern day slavery. So you can see the amount of things that they're looking into. They'll also refer and identify potential victims through an established safeguarding and referral routes to first responder agencies, things such as under the National Referral Mechanism for victims of human trafficking or modern slavery. And then they will monitor and register applicants to check for the warning signs of potential exploitation of skilled workers recruited from overseas. So they will notify and collaborate with things like the Home Office, UK Visa and Immigration Service. And where there's evidence for this, they will softly make sure and monitor registration applications to check the warning signs that sponsor licenses are being exploited. So where registered providers hold a UK sponsor license to recruit for skilled workers, they'll be looking into that, and then we'll be working with the Home Office. So you can actually see CQC are reacting, even though it's not within their power. They will be imparting it into part of the Chloes as well. So do bear that in mind that CQC, when inspectors are coming, they may not be inspecting it directly, but they will be evidencing it. And I think it's important to understand that. And just so that you know, this area, overseas workforce, covers so many different departments throughout the government. And it's anything from the Home Office, Department of Business and Trade, HMR Revenue, Customs, so many. So you have to bear that in mind. It's not just one area you can get caught out in. They will be looking at various things as well. Peter, I've got this slide specifically for yourself, and you were at a meeting earlier as well.
Okay, thanks, Dudley. I mean, I've put a couple of links in the chat. One is to the CQC piece that Dudley's mentioned, and if you are aware of or worried about modern day slavery or exploitation of staff, there is, I've put in there, the UK Modern Slavery and Exploitation Helpline. It's anonymous. It's part of the Unseen website. And you can also contact them anonymously in writing. They're very helpful. And we are aware that they have been notified of quite a lot of people. We attended a webinar recently, which was jointly between 3 government bodies, HMRC. Their concerns are around the areas of minimum wage, the Gangmasters and Labour Authority, and the Department for Business. And sometimes we hear that social care is being unjustly picked upon. Well, one of the problems is that many small providers in social care are not very well organised in their business matters. And we have seen quite a lot of exploitation of people coming in to the care market through legal migration routes, being overcharged, being charged for things they don't need to be charged for, and not supported when they get to the UK. So you've now got 3 or 4 government bodies working together, if you like, focusing on social care to not pick on people, but they're actually looking to support those people who are being exploited. And the minimum wage is a very easy area to get wrong. I've put the recording for the whole of this webinar on the LCAS website, so you can go through all the sections of it and you can pull out the items that are of use to you. But do look at the key areas. And again, one of the key things we're seeing with international recruitment is people coming in and in effect being used as agency staff, which is not correct. And they have to work for the organisation that brought them in. They can't be loaned out or hired out by way of agency staff. And this has caused quite a number of problems. And there have been lots of excuses made. None of them work, frankly. Either get it right or don't do it. And again, it's worth saying that a number of social care employers have simply decided that international recruitment is a cheap way of doing it rather than looking at recruiting locally. It isn't. It is quite expensive, and there are other costs apart from simply the licensing costs, etc. And there are routes to acquire people, to get good people locally, people already working in the UK. And one thing that we're looking at is where people have been brought in and abandoned, abused, etc., is getting their license changed so that they can work for other people. And again, back to our colleagues, they're actually working with the Home Office, etc., to try and speed this up, because it is taking quite a long time at the moment, far too long. And these poor souls are being left with nowhere to live, no money to live on, and in danger of being deported. And some of them, if they are deported back to their native country, they will simply end up going to jail because of the debt they carry. And again, if you hear about issues and you don't want to call the helpline, or you'd rather talk to somebody else about it, talk to us. We can try and check it out, but we can have it checked out for you without there being any link to you. Dudley.
Okay, and as you can see here, they've actually said that the care sector is currently a top priority for the ASA. So I think they are leading a joint operational activity focus on the care sector. So outside of CQC, you now got government bodies now coming to organizations, and some organizations have been closed down, and the workforce, especially overseas workforce, have had to be removed. There was a case where Peter will obviously share that, where over 100 workers were displaced, overseas workers, and actually trying to find them work before their time frame elapses to find work in there. I believe it's 60 days. So it's important to understand that. But you can see things such as fees being charged for additional services of up to 14,000 per person. And there people are charging, and then unscrupulous sort of people out there charging for certificate sponsorships being made up and not permitted by the Home Office. You've got things such as students working in excess of hours submitting on their visa, and the potential national minimum wage underpayments. And they've identified things like charging for work finding services, documentation not being issued or being properly completed, terms of contracts not being issued as well, restrictions on work seekers working elsewhere, adverts being incorrect or not having permission to recruit to a role, assignment information not being issued or incomplete, no written documents covering additional, goods or services, for example, DBS, uniform or training, references being obtained from a family member, incomplete records being kept. We work in sort of in our sector, and documentation and compliance is so heavily important. So don't change the way that you work just to fit people in. Actually, if the person hasn't got the right documentation, do not hire them, do not employ them until everything is thorough. Because if you don't, when they do a inspection or come to see you and you don't fit or retain that, then they will come, and then there are people who've been fined, they've lost their sponsorship license. So there's various things like that. So I think it's important to bear that in mind.
Yeah. And just to add, and this is not solely related to those organizations using international recruits. I have seen documents recently from 2 social care providers. This was about terms of employment, contracts of employment, and terms and conditions of work, both of which were illegal, well out of date. The organizations simply hadn't bothered, which could be very costly for them. CQC are checking up on this type of thing now. Many organizations are outsourcing this type of thing to make sure that they are on the ball. They use people like Citation, or you can get a lot of help from LCAS, and that's free, although LCAS do a lot of training, which is very useful, but you would pay for that. But whoever you're employing, make sure you get the paperwork absolutely correct. And again, with DBSs, we've seen problems where there has been, not necessarily with DBS, but with CQC, there's been an unexplained gap in someone's employment, which has caused problems.
I think it's hugely important. I do know that we'll be having Toby Way, who's the lawyer, coming in, and so there'll be some of the questions going to be answering. But I think also have to bear in mind as well that there is really going to be a tightening down on the work on those people coming to the country. Before, when COSs were issued, you're able to put your COS in before and get as many as possible. You're going to have the named person who's coming in and know who they are before anything can take place. So do bear that in mind. I think it's hugely important to take this on board. Otherwise, you could be really experiencing things which aren't going to help you. And I think it should be known as well, where a lot of workplaces now, the makeup of workplaces are about up to 90% of them are from overseas staff. So it's also as well, not just thinking about those on the compliance stage coming into the country, it's also helping them with retention once they're into the country. And we've been speaking to some senior people around that, especially in regards to things such as pastoral care, onboarding, and there's some various organizations doing that as well. So just to bear in mind. And another thing, which is, I think I'm happy to share, currently some local or some of the ICSs have been doing some funded projects around supporting the workforce coming from overseas. And we're fortunate enough to be working with some of them. So for anyone who is working within Southwest London, kindly, if you want to share or send me and Peter an email, there is potentially funding towards to help you for the overseas workforce, and also as well for accommodation and onboarding as well. So if anyone is in the Southwest London area, please do share or get in touch with me, and we will be able to help you. Anyone based in North Central London as well, we also probably be able to assist you, but that's going to be with when people come to the country in their pastoral care as well. So please do let us know. We will cover you for that and put you in touch with the right relevant parties. But please do get in there quickly. As you can see with what's happening with the government, things are changing rather rapidly. So do make the most of any funding that's been made available, because by March, things may change and it may not be the same as before. So it's important. So please get in touch. We will keep you posted as well. And we also will be having a chain of other sort of seminars as well, where we'll be touching on other areas. So this is not just a one-stop. We're going to be having potentially 10 different types of seminars as well. And we will be having 3 live sessions as well that will be taking place, one in Southwest London, one in Southeast London, and one in North Central London as well, where you probably be able to, we will be bringing in those potentially speakers from either government departments, potentially CQC. We also will be bringing in lawyers in as well that you'll be able to speak to, and have access to recruiters as well, and also ongoing pastoral care sort of trainers as well. So do bear that in mind. We will be having a live session in each of the areas that we're working in. So do bear that in mind in taking place. Peter, I'm not sure if you want to add to it, because I think it's my half an hour done. And
okay. I've just popped in the chat. We've got a registered managers meeting, a virtual meeting on the 13th of December in the morning, which is actually 10 in the morning to 11:30, not 1 till 11:30 as I put in the chat. It is 10 till 11:30. There'll be a lot of information there about getting your paperwork right. We'll circulate the full invitation for that, and also Skills for Care will be there, so they will give you some help. And we've got NICE at that event as well. And a lot of their stuff links directly into CQC, which is useful for you. We're trying to make these events as comprehensive and as useful as possible. To do that, we need you to tell us what you want, what the problem areas are, and we can then get the people in to try and provide the expertise to help you through this program. So we've got quite a lot of local authorities on board, NHS people, CQC, Skills for Care, as Dudley has mentioned. But if there are people you actually want to hear from, then do let us know, and we will do our best to get them to come along.
Indeed. And what we've been doing is now trying to get as much information as possible. This is not just for the purpose of this meeting as well. There's a big drive nationally, and Peter will let you know, a petition about actually trying to get the government to reconsider some of the decisions it's going to be making around the care workforce as well. So they will be sharing out a petition as well to actually support those, especially for those care workers coming into the country, to be able to still be able to come with their dependents, because that's a big part of definitely people coming into this country. We know it can be a lonely space. We're thinking about the mental health and well-being of the staff coming in. So it's a huge, huge area to look at beyond that. But by all means, when we do, we'll be sharing information. So you can put down, for example, the question you want to ask, what area you're based, so we can actually facilitate that with those local authorities that you're in, and then also potentially signpost to funding where possible as well. I've put Q&A here. I know we've got Toby Wayne, who's a lawyer that comes and works with us as well, and he's in the room. He's going to be sharing some information on the complexities of unlocking your sponsorship and the compliances and the costs with it. If you will kindly let him go first, and then we're going to have as much Q&A as possible. So if you can, you'll be able to ask a question in later on. And we'll also take any questions that we haven't answered. We'll take them back and get back to you, and Peter will share that with you as well, for any answers that you do have as well. Thank you, Peter. I think we've got Toby there. I'm not sure if you can add him in as one of the if he may have some slides, or we want to add him in and make him co-host. That'd be fantastic.
It's done.
What do you say? He's there?
Toby.
Okay, well, I think he was there.
Toby's here. He's muted.
Yes.
Okay.
I can't see the share screen. Oh, yes. Here we go. Yeah. Do you want me to
Please
share
do.
mine? Yeah. Okie dokie. Can you see my presentation?
Yep.
Right. So everyone can see my slides, correct? Yeah. So I mean, I thought I would again kind of speed through this bit a little bit, And then, because I know people have a lot of questions, and some of this, some people will know and others won't. So what I was going to go through was costs, and then costs initially, and then go through the application process for 3 steps, essentially a 3-step process. Go through the breaches a little bit, and then the upcoming changes, of which there's, we haven't had the statement of changes yet. So that's the where we're going to have the detail of what's happening. So, we're a little bit limited on the information at the moment. We're sort of going on the Home Secretary's comments at the moment. Okay, so first, to talk about the costs involved. If you're looking to sponsor a carer in terms of through the immigration system, you've got to get the license first. A lot of you probably have done that. I think some of you haven't done it. So 536 if you're a small company, 1476 if you're a large company. If you're being audited, if you're being told to be audited by your accountant for Companies House, you're a large sponsor essentially. There is a formula that I haven't put on there, which is to do with how many employees and assets and income you have. Essentially, it's 50 plus employees, 12.6, I think, assets, and then 6 odd million revenue. But if you're going to be applying for a license, take some advice on that. Step 2, the COS assignment. Quite a few people tend to be called out by this. When you sponsor someone, you've got to pay this, which is, this is essentially a tax. So the COS assignment fee, £239 per person. We're not really sure where it goes. It goes to the Home Office. But thereafter, we don't really know what happens to it. Immigration skills charge, £364 per year. I've put a little illustration in there. It's paid up front. So it will depend on the length of the visa that you're doing. So that's an important consideration when you are proceeding with one of these sponsorships. You've got to bear that point in mind, because that is your liability as the employer. Very important. If the Home Office find that you're passing that cost on to the migrant worker, you're looking at suspension, if not immediate revocation of your license. So very, very important point. Step 3, fees for the health and care visa depend on the length of the visa. So again, a little bit more expensive for a 5-year visa, which is they're relatively common. 284 for 3 years and below. That's just gone up relatively recently. And I'm just assuming I'm not taking Q&A. We'll do Q&A at the end. Just going to run through the application process. And again, if you make a note of questions, because I'm just going to speed through this, because I'm aware I might be boring some people on some points. Sponsor license application, a lot of you may have done this already. To make a valid application, you've got to have 4 supporting documents, and normally, bank statements, EL cert, PAYE proof is, you don't have to provide that. There is a relatively long list of documents you can get. And then proof of CQC, it's very easy to get. And again, I'm assuming in this group, most people are registered with the CQC, if not all, I'm presuming. Cover letter, you've got to hit all the points on the cover letter. So they expect explanation of what the business does, why you need the license, what the job is, what the sort of job is you're going to be sponsoring, what the SOC code is. So, 6145 is typical for people in your business. And then more recently, if we're talking about recent complexity, for the care sector in particular, they are very, very interested in finding out whether you actually have work for the carers, because there has been a fair amount of misuse reported, and also migrants calling up or making it known to various government departments that they are coming in and they're not being provided with work, which is you know, obviously a misuse of the whole regime, and makes life impossible for them when they come over here. So big emphasis now on proving that you have the hours, essentially, through at this stage we're tending to ask clients to provide contracts and rotas, and we're doing we're going down to the detail of kind of doing the maths on the amount of hours that we have available, so they're definitely placing an emphasis on the care sector now. COS application, defined COS and undefined COS, two different types. Defined COS, we apply as and when we need them, and those are for people abroad. Undefined COS, you get a 12-month allocation. So when you apply for your license, you might say, I need 10, but you need to substantiate why you need it. Then you've got 10 to use over that allocation year. Allocation year is running from 12 months from the approval of your license. Once they run out, you can request more. You would use the priority service for the undefined. You have to pay £200 for that, but it's a very slow process if you don't use that. Further information request, again, new complexity. Probably 6 to 12 months ago, we're getting these rubber stamps. Now they're making it very difficult and very slow. I've got a lot of very well-established clients who are having to run through huge hoops every time they apply, and they're asking for huge amounts of information. You know, some of these businesses are quite large, so it's a big bureaucratic burden. Once you have the COS, you assign it, and then we do the visa application. Again, a lot of you will know there's English language requirement, criminal background check. These are for people abroad. And then written skills and experience. The Home Office need you to substantiate why you're hiring these people. So why are you going to the trouble of getting someone from abroad? You ideally, and lots of my clients have hired people with minimal experience, but ideally you want to get strong candidates because they are going to question you on this. They can interview the candidate, I've written, and at the same time they'll normally email you as the employer, and they will cross-check the answers given. Doesn't happen that frequently, but it's starting to happen more. Compliance breaches, I put a few examples from we have a brochure on compliance, just to give you an idea of how the Home Office reacts to breaches. They take them seriously. They take them very seriously. So recruitment wise, you've got to have very strong processes to evidence recruitment. As I understand it, the CQC requires that as well, but the Home Office wants everything to be documented from the get-go. So that will depend on the circumstances. But there is something called Appendix D that stipulates what needs to be kept on file. And as I say, it will depend on how you've recruited that individual. Salary and hours, very important. So this is something that comes up a lot. The salary threshold underpins, I think I said this last time, so it might be slightly dull, but the salary threshold underpins the whole regime. So it's not optional. You must pay these sponsored workers. There's no, there's little wiggle room. And you can't, it's not the council's responsibility, it is your responsibility. So if the council are rolling back hours, I think we had a question last time, the Home Office simply are not interested in that. You are having the responsibility to pay and provide the hours where possible. Otherwise, you're going to get a suspension for sure, and possibly a revocation. We can talk. I mean, you could ask me about that in the Q&A, the way that works, suspensions, etc. Right to work failures. Yeah, right to work checks. I mean, I think most people are probably doing these correctly. That's potentially very expensive if they find out you're not doing those correctly. It's 20,000 at the moment. It's going up to fine wise, going up to 60,000 per person next year. Upcoming changes, spring 2024. We don't have an exact date. The threshold is going up, but that is not going to affect the health and care visa routes. Health and care, no family members. I think you've probably already spoken about this. As CQC registration required. To be fair, I'm not sure if that's going to affect many of you, but the family member issue is obviously something that's going to be affecting a lot of people, or certainly your people you're recruiting from abroad. We don't have all the solid information on this yet, so we've only got what James cleverly has said in Parliament, essentially, and something on the Gov website. The detail will be in the statement of changes that hasn't been issued yet. I've kind of powered through that, but I thought because of the timing, you would prefer to go to the Q&A, and so that is that.
That's fair. Thanks for that, Toby.
Yeah.
I think you've given an indication of really the layout of the costs, the complexities, and the compliances as well. I think, which is the one thing.
Compliance is a huge issue. I mean, I could talk for hours on that. So I don't know if we have a full. We need quite a long session to go through that. So yeah, and there's a lot of different nuances. But
no, I think there was some quick Q&As in the chat as well. I think one of the things I think that people should realize is that there aren't any changes presently, so everything still is the same. So still continue as you were before, because the changes aren't coming in till spring 2024. However, we do know what happens when someone does say something like this. There is a panic and a rush that does take place, and I can imagine that the Home Office are probably going to be inundated, and maybe because of that, actually getting visas and COS.
The issue, I think the main issue is with the COS requests, because they're taking so long. What is completely unfair about the system is if that COS is requested but decided after the change, it's essentially not going to be of any use, because it's the salary rule that applies at the time of the visa application. So it puts us in a difficult situation, because they are being really slow, as a lot of you will know, with the COS requests. So that next year, when we do know the exact date, that there is going to be a huge surge, and I think a lot of people are going to get potentially caught out because of that strange rule.
Thanks for that. I also think as well, and I think Peter will talk about this a bit as well, is that the national living wage is going up. So I think as employers, you have to account for the outgoing costs that you're paying in your service, and HMRC are now involved. So they'll be also monitoring what goes out as well from your organization. So as I said before, it's covering so many areas that you have to sort of like make sure you're on top of. So really getting professional advice so you know where you stand is probably one of the most important things to do in this space. As I said, we're fortunate enough to be supporting you. So please do get in touch with us. So we've access to individuals such as Toby Way, who also has given us advice as well. But also, as I said, we're speaking to those from the Home Office and so forth as well. So it's really important at this time to really bear that in mind. Peter?
There's a question, there's a hand up from Nasro.
Oh, so we're going straight from the Q&A, are we, Peter?
Well, I mean, one of the things I would add about the minimum wage, which can affect international recruits, is what is being removed from their wage packet or their pay, by way of deductions for rent, for accommodation, all sorts of things. And you've got to be very careful about how you do that. And it's almost seems to me sometimes as if the system is looking for fault.
Indeed. I think there's a whole load of there. So, yes, the floor is open. So please.
And I think Nasro had raised his hands for question.
Indeed.
Hi, Nazra for. Sorry, let me put my background off 1 second. Sorry.
That's okay.
Apologies, my work colleague has is got a speaker on. 1 moment. Hello.
Hi.
Yes.
Hi, can you hear guys? Yeah. So let me put my camera on. Sorry. Hi everyone. Just a quick question. I don't know if it's a silly question, but my question is, on the slide it mentioned that skilled work have to be earning 38,000 salary from next year, April, spring. And then it says this does not affect healthcare workers. So I just want to know what's the difference. Yeah, healthcare assistants are in the same as skilled work.
I wasn't sure whether I should have put that on there. It's just that I'd had quite a few people asking that question. So I thought maybe I'd, so health and care, if you're a CQC registered business that's sponsoring a care worker, then you would fall into that visa category, and then you wouldn't. Essentially, it's a sub section of the skilled worker category. Skilled worker, like for example, if I want to sponsor someone in my business as a lawyer or something like that, they would come on a skilled worker, and that new threshold would apply next year whenever it's brought in. But if you're a CQC business, you're sponsoring a carer, they would fall into the health and care category. But if you were to sponsor, let's say you were to sponsor a lawyer in your business who's not carrying out those regulated services, let's say, or a business developer or something, they wouldn't fall into the health and care category. Does that clarify the points?
Yes, thank you so much. That's very clear. Thank you.
So I think we're very fortunate at the moment, be on the shortest sort of like list that, which is the good news that came from it, is that we can take from it for now, and we're exempt from that, or being part of those the uplift that's taken place. So that should be fine. Very quick question, Toby. While you're here, I mean, I know just for clarification purposes, and I know things are slow. How long is it taking generally for COS applications now, from start to finish? Now that we also know there's a lot of sort of backlog.
It depends on the circumstances, because if you get a further information request, it slows everything down substantially. I've had a client recently who waited 8 weeks to get a response for a defined cause after an information request. So that was, I wouldn't say that's the average, but it can happen, and it is happening particularly to care providers. So I've had more than one, and we're talking about kind of well-established firms as well. That will, it's hard to kind of gauge who will be affected. But if you're applying for big numbers, then you're probably more likely to get further information requests. But I think we're almost getting them habitually now. The lead time on the actual decision, sometimes they do make a decision within a couple of weeks, but more often than not, we're seeing, 6 months ago, you could get a decision made in a day. That's not happening anymore in the health and care sector for my clients. So it's really hard for us to tell the client and plan that recruitment, because there's a real variation in the processing time. I think you've got to manage the expectation a little bit now, that, okay, the cause is potentially going to be very slow. Sorry, I know that wasn't a very concise answer.
No. I think it's just getting an idea of timeframes, because a lot of providers actually expect to put it in and then they expect it to come, for example, a week or 2 weeks.
It's just getting longer. It's just getting longer, and they're asking.
I think what we've also found is where organisations have got cause license, got a good reputation, had a number of people, etc., and are trying to help those people who've been dumped here or almost shipped in that are paid to get here. They're looking for undefined licenses and putting in, for example, for 7 and getting 1.
Oh,
no
yes,
explanation.
I've seen that. So when you make a cause allocation increase, that's what you're doing. If let's say you've run out of undefined cause and you want some more, you're writing a request and you've got 1,000 characters or something like that. You've got to include, ideally, okay, why you want it. Okay, we've got 7 people, right? And I'm not sure if this individual has who was that you, Peter, who received the note? Sorry. Do we know so essentially, did this individual include the following: the names of everyone that they wanted to sponsor, date of birth, nationality, immigration status, brief job duties, SOC code, salary, hours? So that's what they want. If you want 7, you've got to include those details in that cause request. You don't want to just say, oh, I want 7, I got 7 people. You've got to be specific. And that
I don't honestly know, but they have been previously successful, and they are what one would call a competent middle-sized social care employer. And they had work for the individuals as well.
So as I say, I mean, it depends. Generally speaking, with those kind of requests, we get the numbers that we want. So it sounds like they may have been missing information in the request, and maybe they were, it had worked before for them, and they thought, okay, well, we'll just do the same. But the more information, the better, and it's got to be specific. So think of the cause, think of the information on the cause, essentially.
Yeah. I think there's a couple of other questions in the chat for Toby as well.
Yeah, there is. I think there's a few, and people can raise their hands as well if they want to ask a specific question. We've got a range of questions here. So I'm just working from the bottom up. So if your application is rejected for example, defined, or if they a request for more information, do you have, you do not have at the time, you don't have the information at the time, could you apply for an undefined whilst preparing for requested information?
You can, but there's a good chance that they are going to liaise. They're different teams, but they can liaise. Although they are, as I said, the Home Office is a silo, and even some teams are siloed, like the application team is siloed off from the defined cause, but from cause teams. But that defined cause team and the cause undefined cause request team are within the same unit, so they can access information, and there will be notes on the system. Generally speaking, you want to reply to that information as best you can before you do anything else.
Okay, thank you. Lillian, you can go, and I'm going to just go through a few of the questions in the chat as well. So Lillian, please, you can unmute.
Thank you. I had a question. I work for a relatively large organization with a staff of around 1,800, and we applied for sponsorship last year, the undefined, whereby we can only transfer people who are already on sponsorship here, and we take them over.
Yes.
But on application, even with proof, submitting everything, because we are a relatively large organization, and showing the rotas, the strategies we have, we were only assigned 15. So is there anything we could have done differently? Because we are now due to apply again, and we really need more people, and we have more proof. But is there anything else we need to do to make sure we get more? Because we had put in for 50 at the time, and they only gave us 15.
So, what did they ask for you for? Did they ask for a list of the people that you're going to sponsor as part of the information request, or did you?
No.
So did you just make an allocation request and you didn't receive any information? You just got 15 approved. Is that what happened?
Yeah.
It will depend on what you put in that request. So number one, they look at what you've used in the past. If you haven't got a long history with them, or you're not using huge numbers already, they will look at that figure, and they'll, you know, potentially adjust your request. And the other point is exactly what I said to Peter. You know, they're expecting 50 names if you're asking for 50 people in the actual request itself. So that's something we can probably, you know, if we could, that's the sort of thing that we help with. So potentially you can get us involved in that. It's quite difficult for me to say without seeing your request to know why it didn't go wrong, but it didn't go correctly. But I think you've probably missed information in the request itself. Another thing is, when you make the request, always take a screenshot so that you've got a record once it's been submitted.
Thank you.
Thank you. I think it's such a great area. There's so many different nuances between different organizations. You know, you get one thing out of place, and as Toby has said, you know, the Home Office are really sticklers, and we've worked with CQC, so we understand that. So actually get your paperwork right is correct. But here comes in that if you're going to do it, and I know a lot of organizations are doing it themselves and not trying to use maybe someone official to help them, or an advisor, then, you know, you also have to understand that this is something that can now take up a lot longer. So it does pay to probably either use maybe a legal advisor, or get some legal advice, or professional advice, or actually just be prepared to pay a little extra, because I think trying to do it on the cheap isn't necessarily going to mean that it's going to work for you. So that's just a piece of advice, and something that I found as well. I'm gonna ask another question in here, which says, can I employ a legal advisor who's already on a graduate visa in the UK for my care agency with the new changes?
Do you want me to take that?
Yeah.
I mean, look, you can sponsor as a business with a license. You can sponsor any number of jobs. If this is a non-care related job that's not regulated, then it's not going to fit into the health and care subcategory. It would go into the skilled worker category. So you can still sponsor that person, but you're going to have to meet a different salary threshold. That person is not going to be exempt from paying the IHS. So they're going to have to pay the IHS, and they're going to have to pay the higher application fee. So the answer is yes, you can sponsor them. Obviously, the job has to be legitimate. The person has to have the right skills, taking that for granted. But they're not going to be applying for a health and care visa purely because you're a CQC business. The job itself matters for that.
I think a straightforward one that's here. I mean, we've got a hand up. So please, Namin, please, you can ask your question if you unmute.
Yes, hi. So it's just a quick one. If we applied for licenses, already got them, because I've heard a lot of mentioning about undefined applications for licenses. So if I'm assuming most of them are for recruiting outside. But if we find candidates within the UK who don't have hours and we want to help them, does that mean we have to do a different application, or once we have the licenses, we just need to change?
Your
Yeah.
your license is not for a defined or undefined. It covers both. So I mean, the license is access to the portal essentially, and then as long as you're A rated, you have the ability to apply for undefined or defined, and any relevant job that you can sponsor. So yeah, does that answer the question? Or I mean,
yes.
Yeah. So you can do it. In other words, the processes are slightly different. So there's people will know there's a separate section for defined, and then to do an allocation increase, it's on a different link within the portal. But yes, you can do it.
I think a lot of people are confused, because I think now there are a lot of people who aren't be able to have their hours matched with various employers, and so they are obviously in the country looking to stay in the country, and they're going to different employers. So a lot of employers, rather than going to get for those overseas staff abroad, they're actually being able to sort of see if they can take them on from the UK. So what would happen if, for example, someone wants to take on someone who's already here, who's coming on a license already through someone else?
So you've got to look at your license summary. You've got to see if you've got any undefined cause. If you go and click on the license summary at the bottom, it will tell you. If you've got one, fantastic. You draft the cause up, you assign it to them, and then they go and apply for their visa. They need a new visa to work for you full time. Very important. You can't bring them on full time until they've got that visa approved. If your license summary says you've got 0, you've got to make an in-year allocation increase application in the way that we've been discussing. So you've got to specify why you need that cause. You pay the £200 priority, because otherwise it's very slow. We're talking about 16 weeks in some cases. And then hopefully the Home Office approve it if you've provided all the information. They can ask for further information, or they can refuse you. So you've got to make sure the request is correct. There isn't any guidance per se on that. So I think that's where, people are finding it difficult. There's nothing in the Home Office website that says you've got to provide this, this, and this in your request. And then, as I say, once you've got the cause, you assign it, you pay those ISC fees. And I think, was it Lillian? I'd forgot to say that, unfortunately, if you are a large employer, the fee is £1,000 per year rather than 364. But you may know that already. I didn't put it on my slide. Yeah.
So it's the notion of, obviously, because obviously someone coming from abroad, they have to apply for a visa. But if someone's already here, a lot of the time people say, do we have to apply for a visa if they're already in the country? Is probably a lot of the sort of questions that have been asked.
It is, and yeah, you have to get essentially a new visa. It's leave to remain instead of leave to enter. But unfortunately, yes, you need a completely new, because if you think about it, the whole point of the cause is it has your business name on that. It has how do the Home Office know what job that you're giving? They only know it through the cause. So they need a new cause, and they only assess the cause at the visa application stage. So yeah, unfortunately, you have to have a totally new visa.
Okay, thank you. There's a question here. I think you've slightly covered it before. Toby, could you explain no family members and CQC registration required? I think there was, and this, I think this is with what's happened with what's been said by James Cleverly and then statement going forward.
Sorry, which one was that?
So it said, can you explain no family members and CQC registration required? I think it's a question around the point about family members potentially being as dependents, but obviously those who are CQC registered, you would need with the changes going forward, you need to be CQC registered. But I think that you unfortunately may not, or the way the changes are looking, you may not be able to bring your dependents in.
Yeah, the CQC registration bit, as I say, does that really? I don't think that's going to affect your members. Am I right in thinking?
Yeah, most
Almost.
people here would be CQC registered to be on the actual shortage list. It's applying to CQC registered members, so I think that's what would be relevant point.
There's
here.
a bit of a complexity there, basically, and it's confusing that 6145 carers is on the shortage occupation list. Okay, you can, and in order to get a health and care visa, to get the exemptions to pay no IHS, to pay a lower fee, that's where the CQC kit comes in. So strictly speaking, at the moment, you can sponsor a non-CQC regulated carer in the skilled worker route, but not obtain the exemptions from payment that you get in the health and care visa. So it's slightly complex in that respect. We don't, I mean, to be honest, the Home Secretary, it sounded like he didn't really know his onions in his speech, because he struggled with some of the terminology. So the fact is, we don't have a lot of information about how it's going to work. So I think what they're going to do is, if you're in the health and care visa category, that's where the restriction is going to be, i.e. if you're applying for that, you can't bring your dependents. What's going to happen to non-CQC regulated carers? I think that bit, you're simply not going to be able to apply at all.
I was in a conversation with CQC earlier this week, and again, I guess it's fair to say that, as with pretty much everybody else, they're not entirely clear of where these things are going. But many people already believed that one had to be CQC registered to bring people in anyway. And the grey area appeared to be where people were, if you like, self-employed care staff. And we've had a couple of examples where, and I see there's a point in the chat from, I think it's Georgia, where care providers who have some CQC registered and some non-CQC registered, the advice given to them, and they are larger providers, so they have, if you like, on-board legal advice. The advice given to them was that the international recruits they took on were to be kept specifically within the area that was covered by their license application, and that was working within the CQC registered locations. Whereas many of the staff move around, as you may well appreciate, those individual people were, in that sense, to stay put.
Yeah, the way the licensing regime is, or the way the rules are set up, doesn't actually work that well for domiciliary care providers, because you have a COS, as you know, and you have a work location on the COS. The work location normally would be the the office, let's say, for the business, and you've got a registered address too on the license, but you'd have your office. And some providers don't even have that. They work from home, and the smaller ones. And then the COS would have the address of that office. But the reality is they're going to clients' homes. Now, you should really be reporting that, the different client addresses, but through the SMS, as the way it's set up at the moment. But that's simply unworkable. So I mean, it's not the way we do it exactly, but we do some reporting in that respect. But the way the rules are set up, strictly speaking, you are meant to report the when the work address changes through the system. It's clunky. It doesn't work for domiciliary care providers, that part of the compliance requirements. But in terms of this CQC thing, as I say, the health and care visa is for the people doing the CQC regulated work.
Yeah.
But you can still sponsor someone doing something else in the business, but they're not going to fit into that subcategory. Yeah. And that's perfectly legal within the rules.
One point that was made with regard to national minimum wage, that if it's a dom care agency and they have an international recruit, if there is 0 hours, then they're almost breaking the rules before they even start, because there is no guarantee that they're going to hit the 26.7 or whatever it is salary band. So they're making a rod for their own back before they actually start. And it seemed almost as if it was giving HMRC a very easy route in to find fault.
I mean, yeah, go on.
No, I mean, I think I agree. I think it's important to realize that for everyone as providers, even if you think that you're meeting the rules, I think, as Peter said, HMRC are going to be looking upon you. You've got other agencies who are going to be really delving into it. So it's not just complying with the Home Office. You've got to be complying with the other sort of agencies as well, which is really important. I know we've got time is going to get the better of us. So we've got Rosamond, I think, is next. And then we've got a few questions in the chat that I want to get through as well.
And I think there's a legacy hand from Narmeen.
Yeah, I think so. So Rosamond, if you can come on, please, and ask your question.
Thank you. We are a very small company, and we give defined COS to few staff from overseas and few staff that work with us in UK here. They were previously students. Most of them have, I mean, dom care is domiciliary is quite difficult, I understand, but most of them have disappeared without contacting us. I mean, it's as well as it's bad that some employers are not being very good, but we are providing the work, we are doing everything we have to do, but some of them are just disappearing without notice. They are leaving London to live outside London without notice. They are moving to different employers without any notifying us at all. Some of them are, some of them aren't. What can we do to protect ourselves as a company to stop our staff from, we've had 6 staff leave in 2 weeks. So we are really struggling. And if they do go, how do we get our money back? Any refund from Home Office for the staff that have left and we had to cancel their COSs?
Do you want me to take that one?
Please do.
Well, okay, main thing is reporting. So are you reporting that they've left employment? That's the main thing. And
yes,
you're doing that.
We try to make contact with them as much as we can. We try to email, we try to make telephone contact, but some people, I don't think they understand the rules, but I do report it.
You do report it. I've just put my email there just in case. So you're reporting it through the SMS in every case, ideally within 10 working days.
Yes.
But even if it's late, the main thing is to get it done. ISC refunds are inconsistent, and they should happen, but they normally discount the first year, so you're going to lose that first year, normally speaking. Secondly, as I say, it should happen automatically within 90 days. There is an email address you can email if it doesn't happen. So it will depend on the circumstances whether you get that back. The assignment fee you lose it. So that what used to be 199 and now it's 239, you lose that. So potentially you're losing, £239 and 364 straight away.
But is there any ways to retain the staff a bit longer or to stop them from moving on as quickly as they're doing it?
I mean, from an immigration point of view, no is the answer. Because, I mean, you can't, that might be an employment related question, having a, strong employment contract with kind of clawbacks for any costs. But again, you've got to be careful because the ISC, you can't get it back in any situation. So that's the COS, the tax that you pay when you assign the COS. Obviously they're going to get a curtailment letter. If you tell the Home Office that they're not working for you, they are going to receive a letter saying, okay, we're curtailing your visa. So that should be quite a strong, inducement not to leave.
I mean, I'm going to come in here very quickly. I think I agree with you. I think what you found is that individuals were coming to parts of the country and then leaving as soon as they came to go to other desirable employers. And obviously, we know staff talk. I think a part and parcel of the sort of like events that we're running, it's to get your business so that when people are coming in here, you do your due diligence, you make sure you have packages in place, you have things such as buddies. Because it's something which sometimes, just like any employer, regardless whether they're from abroad or here, their heads can be turned very easily. All you can do is follow the regulations and rules and report if someone has come in under through yourself, and then obviously report that they're not with you anymore. I think that's what you have to do officially, but I think the other side of it is just to make sure you have things in place to try and keep them there. And that's part of things around the pastoral care, which is highly important. So thank you for that. And we're going to have Helma, and then we're going to just we're going to ask a few questions in the chat. We've got a range of questions that we've had beforehand and in the chat as well, and we'll get back to you as best as possible. Toby's with us as well. His information is there. So we will be able to catch up with everyone as much as possible. This recording being made available as well, and the slides as well. So Helma, if you can kindly come in very quickly, please.
Thank you very much. My question comes in very well after what has just been discussed about refunds. So we applied for COS, and before they were issued, the minimum wage changed. So when our recruits applied for visas, were all rejected or refused because of the minimum wage issue. And we had to pay for new COS. So my question is, how do we get our refunds? Because it should have been refunded within 90 days. That hasn't happened. And it's just how we get it back.
That you have to email them is the short answer. I'll if you email me your address, I'll forward you the relevant email address that you need to. You're gonna have to change them, chase them, unfortunately. And that, how long ago was that?
It's over it's literally, I think, over 3 months now, because quite a number of candidates got rejected. We had about 15, 20 candidates. So, and I just wanted all the candidates to reach that 90 days before I could start chasing. I wanted to chase all at the same time.
Yeah, it's a lot of money, isn't it? Yeah.
Yeah.
Mm. Okay, send me an email and I can forward you that address.
Thank you very much.
Thank you. There was a question in the chat, Peter. It says here, Toby, what happens after 5 years on sponsorship care assistance? Can care staff apply to remain in the UK after that period of time? Or I guess even 3 years or 5 years, or when their time elapses, what takes place from there?
Extension, if you're, I mean, you want to hit the 5 years. Once you've been here 5 years, you can apply for ILR. Have to do life in the UK test. There is a salary threshold. I'm not entirely sure if it is going to apply to people in health and care. I presume not. I haven't actually checked because we've not had anyone who's hit the 5 years yet. Yeah, it's as long as they haven't been out of the country more than 180 days in any 12-month period in the 5 years, then they can apply for indefinite leave to remain, and thereafter they can work wherever, and also apply for a British passport 12 months after that.
Thank you very much. I mean, I think we're almost through. I think there's so many questions to look at and to think about.
There's a question that seems to have come to me directly, which is just quickly, what will be the Home Office ways of inspection? This is an operator that's new to a sponsorship license holder.
Yeah. Well, they do digital compliance checks. So this is someone's got a license already. They can do a digital compliance check, which would be a Teams meeting. Or they can come to your premise They're normally speaking, they're doing a lot of these video calls at the moment, which they're still very extensive meetings. But as I say, they can come to the premise, and they can come without setting something up through, organizing anything, i.e. an unannounced visit. They don't happen that much, but they do happen, I think, if they get intelligence that there is breaches going on, good intelligence, i.e. not just someone calling up. And I've also recently had a client who's had their license suspended without any sort of audit, literally because there's been some intelligence that they're not paying the right salaries, they're not providing the hours, which that is pretty unusual. This is a compliant business, so that's quite worrying, to be fair. So I don't know if that's going to be rolled out a lot now, because normally speaking, they will do the checks first. They're not going to just suspend your license. But if they're going to kind of try and expedite this revocation system, and they're doing more of that, it's worrying, because it's a lot of work for us, and we have to charge quite a bit of money to do it. So that's a big cost for the business. I think, sorry, I kind of expanded the question too much there, but the point is they'll do a video meeting, or potentially they'll come to your premise. Normally speaking, they will organize that with you first.
Thank you very much, Toby, and thanks for joining us. I will say something very quickly. What Toby has found, and I think everyone who knows about CQC, is that we obviously know about inspections. What Toby has looked at doing is having mock inspections and inspections that can support all your businesses as well. So please do be in touch. Mock inspections are really important to actually make sure you're in compliance with what the Home Office regulations are. Yep. And as things are changing, it's really good to get up to speed, even for an overview. So he's put his information in the chat. So even a call or so, and some of the questions, he may not answer all of them all in one go, but definitely it's a query that's there. I know we've got him here, and he's kindly come in on his own time to really support us, but he will be able to maybe support you in a more official capacity. So please do be in touch. So thank you for that, for joining us, Toby.
Pleasure.
You can see here, we've got our information here. I put in the chat that there is some funded support for those, especially in Southwest London area, from start to finish, and also as well for North Central London in the pastoral care for those once they've come in. So things around accommodation, and also support around other matters in sort of onboarding and helping staff get to work into the working capacity and community. Peter, I'm going to leave you just to share some of the upcoming dates of events that are taking place.
Okay. We've got a registered managers meeting, a virtual meeting on 13th, and we are looking at putting a further meeting around international recruitment in on the 14th. We didn't have anything else scheduled for this year, but because of the number of queries and changes, we're just checking with a couple of speakers, and if that comes to pass, then we will do that. As Dudley mentioned earlier, we've got a series of virtual meetings, and within the next 10 days, we'll have the dates for the live meetings confirmed as well. Again, if you do have any queries, anything you want to talk to us about, please contact us. I would urge you to sign the petition, and quite a lot of people are also considering writing to their MP. If you need information on that, let us know, because we can tell you how to access your MP quite easily. Do it by email, and also we can do you a template letter which covers the points. And as I say, thank you very much for your time. Thank you very much, Toby. It's very useful stuff. One thing I would say from comments that we picked up from CQC meetings, a few weeks ago, we didn't get the impression that CQC were taking their role in international recruitment very seriously. It wasn't their problem, etc., etc. I think they now have realised that it is something that organisations are turning to CQC because they see them as a regulator, as the body they deal with. So CQC are now taking it much more seriously. They're working very closely with the Home Office. And I think the whole issue around modern day slavery and exploitations has rattled a lot of cages. And exploitation is much more likely to catch more people out than modern day slavery. So please beware. And thank you very much for coming. Thank you, Dudley. Thank you, Toby. And thank you all for attending. And have a good weekend. And we look forward to seeing you at the next event.